Hi everyone, my name is Jizhou Huang from Baidu. Today I will present our work on understanding the impact of the COVID-19 pandemic on transportation-related behaviors with human mobility data. COVID-19 has spread rapidly worldwide, and the number of newly reported cases continues to grow. There has been more than 6 million confirmed cases of COVID-19 based on the data reported by WHO as of June 2020. The pandemic has changed the lives of the 7.8 billion people in the world. From a report of United Nations Development Program, we can see that the pandemic has a strong impact on nearly every aspect of the socio-economic. After the outbreak, the Chinese government adopted the most comprehensive, stringent, and thorough prevention and control measures in an attempt to bring the virus under control. With great courage and will, the spread of the virus has almost been tamed, making an initial triumph for the country. The major epidemic prevention measures that China has taken are universal consensus and public mobilization, social isolation and traffic control, command system and strategic policies. From this figure, we can see that short period in about 3 months of transmission and the sub-exponential increase of confirmed cases in mainland China. This phenomenon has proved that the Chinese authorities took effective epidemic prevention measures. In our work, we mainly focus on people's response to social isolation and traffic control. Detailed epidemic prevention measures under this topic include city lockdown and transport freeze in hardest areas, prevent social gathering and cross-infections, closing reaction values, and so on. We consider that the containment policy is a double-edged sword. On the one hand, the restrictions on human mobility can constrain the outbreak of the COVID-19 pandemic. On the other hand, virus impact of the combination of COVID-19 and the mobility controls emerges during the pandemic. We believe a direct impact of this pandemic is on transport-related behaviors of the public. Therefore, the far-reaching significance of understanding the impact of COVID-19 on transportation-related behaviors is to provide more specific policy-making suggestions on anti-epidemic measures. Here comes the question that how do we get to know the transport-related behaviors of the public? We believe that the human mobility data collected from web mapping applications could help us conduct data-driven analysis on transportation-related behaviors during the pandemic. These two figures illustrate the weekly normalized frequency of the users in mainland China who leveraged Baidu Maps, a widely used web mapping application in China, to navigate to their desired values by bicycle and public transit in the first 18 weeks of the year 2018, 2019, and 2020. We also plot the curve of the number of confirmed cases to explore the relationship between the severity of the COVID-19 pandemic and means of transportation preferred by the public. We can see from the figure that both means of transportation in the years of 2018 and 2019 is relatively consistent with strong positive correlations. However, as the COVID-19 began to outbreak from the 5th week of the year 2020, the correlation on the two means of transportation between the year 2019 and 2020 dramatically changed. Moreover, we find a positive correlation between the number of confirmed cases and the weekly normalized frequency of transportation by bicycle, as well as a negative correlation between the confirmed cases and the weekly normalized frequency of transportation by public transit. Both statistical results indicate that the pandemic has an impact on the two kinds of transportation-related behaviors of the public. Given that mainland China has just passed the outbreak period of COVID-19, those initial findings from this figure further drive us to look into more details on transportation-related reactions of the people there during the pandemic. We use the huge amount of human mobility data collected from Baidu Maps to understand the impact of COVID-19 on transportation-related behaviors. Based on the data-driven analysis, we give our specific insights and policy-making suggestions. Baidu Maps is one of the largest web mapping applications with over 340 million monthly active users worldwide by the end of December 2016. We believe the data-driven analysis on transportation-related behaviors and the statistical results from the vast volumes of human mobility data are significant. The data sample is a tuple, which is composed of the classical OTD information as well as the time. We conduct data-driven analysis on transportation-related behaviors during the pandemic based on this data. To be specific, the transportation-related behaviors concerned in this paper include means of transportation, type of visited values, check-in time of values, OD distance, OTD patterns. These topics have covered almost all aspects of transportation-related behaviors from the perspective of transportation, origin destination values, origin transportation destination triplets. First, let's see the means of transportation. From this figure, we can see that the proportions of the means of transportation from January to April in the years of 2018 and 2019 are highly stable and consistent without the impact of COVID-19 pandemic during these periods. The people in mainland China prefer taking public transit as 54% navigation requests on average at Baidu Maps choose to take this means of transportation to reach the destinations. However, the proportion of taking public transit declines to 45% in the first 4 months of the year 2020. What's worse, along with the most severe outbreak in February 2020, the proportion of taking public transit dramatically declines to 40%. On the contrary, the proportions of taking a private vehicle and riding a bicycle significantly increased during the outbreak of COVID-19. Compared with the statistics at the same periods in 2018 and 2019, the proportion of taking a private vehicle increased by about 3%, and the proportion of riding a bicycle increases by about 5%. Both changes indicate that more people prefer taking private transportation during the pandemic, which can minimize human contact. According to the insights on the data analysis on means of transportation, we find out that the people in mainland China prefer taking private transportation, such as taking a private vehicle and riding on a bicycle to minimize human contact rather than taking public transit. This inevitably leads to a great increment in traffic pressure. To ease the traffic pressure, our policy-making suggestions are as follows. Given the possibility of future outbreaks of COVID-19 or other emerging infectious diseases, the authorities could encourage more people to travel by bicycle and consider temporarily expanding the dedicated bicycle lanes. The authorities may coordinate the working hours of various companies and suggest the public to travel in different peaks. Next, we will introduce the change in type of visited values. We can see from this figure that the distribution of visiting frequency of the top 10 hottest types of values are highly stable and consistent from January to April in the years of 2018 and 2019. Without the impact of the COVID-19 pandemic, the proportions of visiting residential areas and transport facilities are stable at about 22% and 23% on average, respectively. When the COVID-19 outbreaks, the proportion of visiting residential areas greatly increases to about 31%, and the proportion of visiting transport facilities rapidly declines to 19%. Both alterations indicate that more people might prefer staying indoors as well as limit the frequency of going outdoors, which can minimize both human contact and the risk of infection during the pandemic. The proportion of workplaces also increases after the pandemic outbreak. The proportion of hospitals and pharmacies slightly increases by about 1% due to the COVID-19 pandemic. As for other types, such as restaurants and beverages, parks and scenic spots, educational institutes, and hotels, however, the visiting frequency of them in 2020 shrinks compared with those in the same periods of 2018 and 2019. According to the insights on the data analysis on types of visited venues, we find out that the people in mainland China prefer staying indoors or visiting hospitals, pharmacies. This phenomenon may suggest the authorities to make policies as follows. For residential areas as well as hospitals and pharmacies, the authorities need to invest more effort in these venues to limit transmission to susceptible individuals and minimize the risk of cross-infection. After the pandemic is over, more economic support policies should be formulated for restaurants and beverages, parks and scenic spots, educational institutes, and hotels. Next, we will show the change in check-in time of venues. To check out the consistency of the check-in time without the impact of COVID-19, we calculate the correlation between the histograms of 2018 and 2019. Given the three sub-figures in this figure, we can obtain three positive correlations between the histograms of 2018 and 2019, regardless of all day, daylight hours, and night hours. The check-in time in 2018 and 2019 have the same characteristics, that people prefer going outside at weekends without the panic of the disease. However, we gain strongly negative correlations between the histogram of 2020 and the average histogram of 2019 and 2018, indicating that the outbreak of COVID-19 have tremendously changed the way people visit and check in venues. According to the insights on data analysis and on check-in time of venues, we surprisingly find out that the people in mainland China prefer going outdoors on Wednesday and Thursday during the pandemic rather than at weekends. This observation suggests the authorities to pay more attention on both the daylight and night hours of Wednesday and Thursday rather than weekends. This figure illustrates the origin destination distance of navigation recorded by Baidu Maps in mainland China. We first categorize the OD distance into different buckets and then compute the proportions of each bucket by month. To be specific, the proportion of the long distance preference in February 2020 increases by 2% in comparison with that averaged over those in February 2018 and 2019. This figure amplifies the distance that's larger than 30 kilometers, from which we can see that the proportion of OD distance that's larger than 300 kilometers in February 2020 is significantly greater than those in February 2018 and 2019. The bucket of distance that's larger than 300 kilometers in this figure is amplified in February 2020, which is probably caused by the behaviors of the intercity navigation. In order to make quantitative analysis on this, we further present this figure to figure out the distribution of normalized frequency of intracity and intercity traveling behaviors. We can see that the proportion of intercity navigation requests declined in March and April in 2020. The containment policy imposed by the Chinese authorities has been proved to effectively control the spread of COVID-19. The impact of this policy can be evidenced by the declined proportion of intercity navigation requests as shown by this figure. We believe the change of OTT patterns can directly reflect the impact of the COVID-19 pandemic on transportation-related behaviors of the public. We explore the high-frequent OTT patterns from January to April in the years of 2018, 2019, and 2020, respectively, and demonstrate the top 20 hottest origin transportation destination patterns grouped by the 4 meanings of transportation in this table. In addition, we use the type of venues to denote the origin and the destination instead of the specific point of interest names for the purpose of generalization. The most dramatic change of people's travel patterns, that's the top one OTD pattern during the pandemic in the year 2020, is that the start and end points of navigation are replaced by residential areas from transport facilities. Moreover, the public prefers riding on a bicycle and taking a private vehicle rather than taking public transit. This change implies that people are willing to take zero-touch transportation to and from their places of residence to lower the risk of infection and maybe to enhance physical fitness. Starting from residential area or transport facilities, the people in mainland China would like to visit hotels and educational institutes in line with the top 5 OTD patterns in the years of 2018 and 2019. However, the destinations have entirely changed from hotels and educational institutes to workplaces and markets based on the top 5 OTD patterns during the pandemic in 2020. This phenomenon may be partly due to the containment policy, which stimulates the need to stockpile daily necessities and resume work, as destinations, restaurants, and beverages, as well as parks and scenic spots, disappear from the top 10 OTD patterns in 2020 in comparison with those in the years of 2018 and 2019. We believe that this result is mainly caused by the countermeasures carried out by the Chinese authorities, including quarantines, travel restrictions, social distancing, digital contact tracing, suspending intra-city public transport, shutting down the reaction venues, and banning public gatherings. These interventions have effectively curbed the spread of COVID-19, but meanwhile, they do have a significant impact on travel behavior as well as public transport supply and needs. In addition, the rank of hospitals and pharmacies as the destination jumps to 7th with the aid of public transit. This change needs to be given enough attention because the potential suspects are more likely to spread the disease by taking public transportation. The increased proportion of taking public transit to hospitals and pharmacies should draw much attention from the authorities, as this OTD pattern tends to exacerbate the risk of infectious disease transmission. Therefore, we propose to strengthen the quarantine measures at transport facilities. Moreover, the COVID-19 pandemic causes markets and workplaces to be the preferred destinations rather than hotels and educational institutes when people decide to go outside. To stockpile daily necessities and to resume work become the preferred choice for people in mainland China rather than checking in hotels and visiting educational institutes. Therefore, there is a strong need to strengthen quarantine measures in markets and workplaces. According to the abnormal behaviors of the public during the pandemic, we give our specific insights and policy-making suggestions for each perspective, which are listed below. As the COVID-19 pandemic is still spreading in more than 200 overseas countries, infecting more than 10 million people around the world, those insights and suggestions may help people better fight the disease. Moreover, we hope that our insights can further inspire the following work on predicting the prevalence of other similar infectious diseases with human mobility data. That's all of our research. Thanks for your attention.